Nail dystrophy is actually a category of conditions that are characterized by affecting the appearance of the nail, making it abnormal. The appearance of the nail can be changed starting with the color of the nail, through roughening of the nail or changing of the texture of the nail, and there are other changes of the nail that can make it look odd or unusual. And all those conditions that cause those nail changes are causing a category of conditions that is called nail dystrophy. All these conditions can lead to nail dystrophy on its various forms. There are numerous types of conditions and factors that can lead to nail dystrophy. One is trauma. Other conditions are genetically inherited conditions, nutritional deficits, chronic inflammatory conditions such as eczema of the cuticle, psoriasis, specifically nail psoriasis, lichen planus. There are infectious causes such as nail fungus and warts of the nails. And even a condition called alopecia areata, which is a form of hair loss, can cause a form of nail dystrophy. Yes, a hair loss condition can actually affect the way the nails appear. So this is obviously a highly complex group or a category of conditions. It needs to be managed with a lot of nuance so you actually arrive, if you can, at the right diagnosis and treatment plan to make your condition better or even turn it around to complete resolution. So what to avoid? Well, because nail dystrophy is such a complex group of conditions, I would caution you against going at it alone. Nails are notoriously slow to grow, even under the best of conditions. Your condition, if it is turning around with the right diagnosis and treatment, is going to take at least a few months for the normal nail to grow out and show up as normal nail, completely normal and completely cured. We're talking about 3 to 6 months with fingernails and 6 to even 12 months with toenails. So these grow out very slowly, and if the treatment works, the nail will have to grow out normally to finally replace the diseased nail. So that is very important. Don't go at it alone. It's also important to remember that nail dystrophy, even when there is a cause, a clear and distinct cause, such as warts or nail fungus or other causes, in many cases the underlying factor is nail trauma. So do your best to avoid practices or habits that are traumatizing the nail, specifically nail biting, nail trimming, or grooming practices that may traumatize the nail. And exercise, especially with the right kind of shoe. Shoes that are kind of loosely fitting can actually cause trauma to the nail plate and eventually cause onycholysis, which is separation of the nail plate from the nail bed. That can lead to fungal infection and other issues. So what do? Well, team up with a board-certified dermatologist. The dermatologist will take a look at your nails, will ask you a few questions, will do the appropriate tests, and then come up with a treatment plan to treat your nails. Nail treatment is, as I said, it takes a long time to turn things around, even with the best of intentions, the best diagnostic criteria, and the best treatment options. So you need to be patient. Obviously, set the stage with your dermatologist. Get the time frame in which you can expect to see changes in the nail, and when can you expect to see the condition completely resolved. These are very important questions to clarify with your dermatologist, so be sure to do that. In some cases, nail dystrophy can respond to topical treatment. It usually does not, but if it does, that's beautiful. In some cases, it requires systemic medication. And as I've mentioned before, nail dystrophy in many cases is related to nail trauma. So be sure to ask your dermatologist about those practices and habits that you're incorporating into your lifestyle and how you can mitigate those factors that are affecting your nail. Well, thank you so much for watching this video. If you got some benefit from it, please hit the like and subscribe button. More great content coming your way right from this channel. Thanks for watching, and God bless.
Ryan Little.